Hello. This is a follow-up video to my first video. Basically, I just wanted to go into more detail as to what happened to me, and I will be doing this video in a little bit of a different format from the last one. The first one, I created a script for myself that I followed throughout the video because I knew that I wouldn't take the step to make a video had I not had a script there. And this one, I made a bunch of notes, and so I'm just going to be referring to those notes throughout the video. But I'm sure you'll hear a lot more ums and weird stalling noises, which could get annoying. But I am not going to edit this video. I'm just going to keep it as raw and honest as possible, and tell my story. So yeah, let's just start at the very beginning. That launched this, essentially what I now know as a severe nervous system injury. Back in 2013, 2023, I had a dental procedure, and the very next day, I started having a lot of panic attack symptoms and also new symptoms for me. I just remember having a lot of chest tightness and heaviness, but also some like tingling in my limbs and just feeling extremely overwhelmed and panicky. So I was driving while this was happening, so I had to pull over and I immediately called one of my good friends and my mom, I believe, and I was in really bad shape. So I ended up later discovering that during the dental procedure, I was given the maximum amount of lidocaine with epinephrine, and learned that oftentimes dentists will mix epinephrine into the lidocaine because it allows the lidocaine to last longer, and it also helps prevent bleeding during a procedure. So I was not aware of this. I was not given informed consent prior to the procedure. The doctor just saw that I was in an immense amount of pain because I had had a lot of dental trauma prior to this procedure, and kept injecting me with this lidocaine with epinephrine. So I believe a couple days later, I went to the ER, and I'm someone who, I hadn't been to the emergency room actually prior to this. Actually, one time, I take that back, in grad school a couple of years earlier, I had a pretty severe testicular infection, and I was in a lot of pain. So I did go for that, but my whole life prior to that, no ER visits, meaning that I have a really high pain tolerance, and things typically resolve with me before I get to that level. But this felt different. So I went to the ER, and one of the ER doctors had given me a small dose of Ativan, which I learned is quite common, especially people who are presenting with panic. And that's what it looked like. And actually that's how I felt too. I was like, am I just having an extreme bout of anxiety? Because I'm not thinking, oh my gosh, this is from the dental procedure. And I had when I was a lot younger, my mom actually introduced me to Ativan, and I had taken, I believe, 0.5, the smallest dose that one can be prescribed when I was younger, a younger adult, to get rid of anxiety if I had like a big speech or a big audition or something. And I just remember it kind of taking away those nerves, but not making me feel weird or different or high or any of that. And so when the doctor at the ER had offered me Ativan, I wasn't registering that it's a benzodiazepine. In fact, I didn't even know what a benzodiazepine was or all of the horrors and the harm that they cause at the time. And this is someone with a master's in clinical mental health counseling. We were not given a lot of education around benzodiazepines. So anyway, I was just thinking, yeah, I've taken this before, no problem. Happy to try it out. They wanted to give me 1 milligram at first for my body size, my weight. And I said, you know what? No, I've taken half of a milligram before and I'm really sensitive to medications in general. So if you don't mind, let's just start with that. And they were like, sure. And so that's what we did, half a milligram. And sure enough, it took away all those, pretty much every symptom that I came in with. I could breathe again. My chest wasn't super tight. I wasn't feeling the numbness and tingling anymore. I was feeling more calm. And so the doctor proceeded to give me a prescription for Ativan for 30 days to take as needed, 1 to 3 pills a day of 0.5 milligrams. So either, 0.5 to 1.5 per day, depending, with no warning about how they can cause physical dependency or seizures or death, none of that. Even though I later found out that there's a black box label that was added in 2020, so just 3 years prior, talking about how benzodiazepines should not be used long term. It might have said more than like a couple weeks or something, which is better than nothing. But now, knowing what I know, they should never be used more than a week max. I would even say a few days is very dangerous. Not because they create addictions in the same way that other drugs do, but because they cause physical dependency. So in the same way that someone is taking their blood pressure medication or insulin for diabetes, it keeps these symptoms, it keeps the blood sugar in control or your blood pressure in control, but you're not feeling high or, you're not abusing the medication. But when you take it away, the body doesn't know what to do. It's been reliant on these, so for blood pressure medications, it's been reliant on that to keep the blood pressure in check. So when it's taken away, the body freaks out and doesn't know what to do. And so it takes a long time for the body to reacclimate to its natural processes and to find homeostasis. So the same thing with these benzodiazepines. Even talking about this, I can feel myself getting a little bit out of breath. I'm just wondering, it's because the body does keep the score and all this trauma is resurfacing as I talk about it. But here we are, and we're going to power through. So referring back to the notes, I do want to mention that in grad school at the beginning of 2020, I was also seeing a therapist, it was highly encouraged for us as grad students in counseling to also be getting our own mental health therapy, which I thought was a wonderful idea. And so I was doing that, especially going through some pretty extreme things in my life at that point, some pretty heavy grief, and which I'll touch on later in the video. And so I was using insurance, and by the way, if you don't know, if you're seeing a therapist and using your health insurance to cover the costs, these health insurance companies require diagnoses in order to basically say that the patient is being adequately treated, which is wild, but that's how it works. So the therapist that I had been seeing, we had agreed to give me a generalized anxiety diagnosis, which is one of the least harmful diagnoses to give a patient or a client. And by the way, also what I had learned through this process, which I didn't know prior, even as a grad student, was that these diagnoses will stay on your medical record permanently. And it's not like other therapists, other mental health professionals see this. Other doctors in general, and medical doctors will see your health record. So when I presented to this emergency room they saw generalized anxiety disorder on my chart and a recent diagnosis at that. So I came in and I'm being viewed because I had subsequent ER visits in this process, I'm being viewed as a highly anxious person, someone who presents with panic. And so I'm automatically discredited in that regard. So moving along in the story, I mentioned I was prescribed 30 days. I was taking, some days I would take it, some I wouldn't. Some days I would take 1, meaning 0.5 milligrams. Other days I would take 1.5 if I felt it was necessary. And then some days, I would go like 2 or 3 days without taking anything. Because I don't like medication in general, and I don't want to be reliant on medication. And so anyway, so I started experiencing what I now know as interdose withdrawal. But I had these very scary symptoms that I'd never felt before, where I would go hiking, because I was a very active person prior to all this. And so I would go on these hikes for about an hour and a half, 2 hours a day. And I started noticing in my hikes, I would become very winded and I had to sit down. And then that turned into, I had to lay down in order to find relief and to catch my breath. And so that would get worse and worse as the weeks went on. Like at first I noticed maybe like an hour within my hike, I would feel that way. And then within 30 minutes, and then within, I think, 5 or 10 minutes. So I noticed some symptoms like trouble sleeping. I had night sweats. Like I mentioned, the difficulty breathing in the chest, heaviness and tightness, and only really finding relief lying flat. So that was very strange to me. But in speaking with, I think I called a nurse through my health insurance, how you can call all those nurses on call. And I talked to family members, and basically it was just chalked up to panic and anxiety. And having just finished a really stressful time in grad school, and I had just moved at the time as well to a new state, and coming off the heels of extreme grief, it was just assumed that I was going through anxiety. So also, I think this is an important bit too. At the time, I was using doxycycline as needed as post-exposure prophylaxis. So in the gay community, it's quite common that people will take, it's called doxy-pep. So if you're engaged in any kind of sexual activity that presents a risk for STI transmission, oftentimes people will take a pretty minimal dose of doxycycline, although now I know that all antibiotics are pretty intense medications. But to prevent getting STIs like gonorrhea, chlamydia, syphilis. And so I was taking that as well. So my gut was completely destroyed, which I now know is very significant in the way that I reacted to coming off of these to the Ativan. And I also, as just to provide some important backstory, is I had a previous history of taking a fluoroquinolone, which also has a black box, I think several black box warnings, saying, there are people that unfortunately will take 1 dose of these things and never walk again. They're very serious, and they should only be, in my opinion, administered in a life or death circumstance. But I had previously mentioned that I had a testicular infection, and so I was prescribed Levaquin, which is a fluoroquinolone. And after my first dose, I started feeling weird, strange symptoms with my heart, fluctuations when I would stand or sit. And then I had the numbness and the tingling and some really severe tendon pain as well, which I later learned that's a pretty common, so much so that it's on the black box warning, that people's tendons will rupture just by walking, by carrying on with normal daily activity when they are taking fluoroquinolone antibiotics. So I started feeling that after one dose, which is wild. But anyway, because I felt so uneasy after taking it, thank God I stopped taking that medication. But that was something that had really sensitized my nervous system. And on top of that, in those previous few years since the COVID pandemic started, I had taken a COVID vaccine and then 2 booster shots as well. So 3 COVID vaccines in total, which later on research had shown can cause POTS and other heart issues as well. And then there was one other, I ended up going on a cruise and getting bit by a monkey in the Dominican Republic. And so for safety precautions, I underwent a series of rabies vaccines. I believe there were 3 shots in total. And I think this was in 2022. So all within a few years, I had COVID vaccines, rabies vaccines, exposure to this really dangerous fluoroquinolone antibiotic, and then now epinephrine from the dental visit and benzodiazepines. So this was all just a recipe for disaster for my nervous system. Let me find in my notes where I am. Yes, so I mentioned the extreme grief, but in grad school, I actually unfortunately lost my brother to, we don't know the exact everything that happened to him, but my suspicion based off of the autopsy report and other things that I know surrounding the situation is he had passed away. He died from taking a Xanax that was laced with fentanyl. When I learned this in 2021, I had no idea that a Xanax was a benzodiazepine, same class of medication as that Ativan is in. And then on top of that, I lost my stepmom to cancer in 2023. So 2 years, not only going through a lot of stress, rewarding stress. I mean, one of the best things I've done in my life is go to grad school to become a therapist. But coupled with all this grief, this is also wreaking a lot of havoc, it's just a lot for the nervous system to take on. So when you pair that with all of these pharmaceutical injuries, it's no wonder that my body and my mind reacted the way that they did. So in my research, trying to figure out what's going on, I had contacted a local hospital who had referred me to an addiction specialist, which was so interesting. Since I was not dealing with an addiction, I have never had an addiction, nor was I getting high or seeking out anything. I was taking this medication as needed and in a minimal dose or not taking it at all. However, in Google searching, because this was prior to ChatGPT and AI really taking off, the first thing that you see on the first page of Google are the websites that pay for promotion. So when you search Ativan or benzodiazepines, the first things that pop up are all these detox and addiction centers that are just trying to sell you their service. And warnings of you need medical supervision to navigate benzodiazepines in order to prevent seizures and or death. So there's just a lot of fear mongering, and then they're automatically placed into this umbrella of other illicit substances that are often abused. So anyway, this this hospital tells me that they have an addiction specialist who is retired, but really knows his way around benzodiazepines. So I hire him, and he prescribes me phenobarbital, which is quite standard in these detox clinics in order to come off of benzodiazepines to help prevent seizures and or potentially death. However, now, after all of the research and other people that I've talked to who have gone through this, I now know that the best way to come off of benzodiazepine is very, very slow, a very slow, hyperbolic, steady taper over months, if not years. But he was of the mindset that a lot of these detox centers have of just ripping you off, kind of like if someone comes in who had been abusing alcohol, they'll often put them on benzodiazepines for about, I think, a week tops, and then they just stop. And typically people are fine. So he had me cold turkey this Ativan that I had been taking off and on for 4 weeks, for about a month at that point. Or it might have been 5 weeks, 4 to 5 weeks. And it just blew my nervous system to shreds. I mean, I wasn't sleeping. I was I couldn't stop moving and twitching. I couldn't eat. I mean, it was horrifying. And I was telling him that I was extremely terrified and I had all these symptoms and I had to go back to the ER. And he basically said that I was too difficult of a patient. It makes my heart just so sad for me, in the height of my suffering, for someone to have not only caused so much harm, but then also to quickly dismiss me. It was horrifying. So yeah, he was paid $4,000 to basically cold turkey me off of Ativan, and then told me that I was too difficult to work with and stopped working with me. So in my frantic Googling, I'm seeing all these websites and advertisements for detox centers, and I know in my head, I'm like, well, I don't have an addiction, so I don't need to go to an addictions or a detox center in that regard. But I found this one place called Laguna Treatment Hospital. And because they had a hospital at the end of their name, and they advertised dealing with people who are taking benzodiazepines on their website, I figured, oh, well, at least I can go to this place where I'll have supervision by trained medical staff to help me safely come off of these things and not have a seizure and not die. I mean, those are right? I'm not asking for much here. So anyway, so I go with my mom to this hospital, which I learned when I got there. Well, I didn't actually learn until I was admitted to this place that it's basically another detox addictions substance use facility. So it was very inappropriate for their staff to take me in, first of all, when I had told them exactly what I just told you guys and disclosed my whole history of becoming a mental health therapist, working with people with substance use, abuse, addiction, in honor of my brother who had recently passed away. And here they are thinking that I'm someone in active addiction who is in denial or whatever, or they just wanted my money. Perhaps it was a combination of both. I don't know. So I get admitted to this place, which was a huge mistake. And I highly recommend that you do not go to a detox center if you are trying to come off of benzodiazepines. Again, benzodiazepines are supposed to be a patient-led experience coming off, and it should be a very slow, steady, hyperbolic taper over months and or years. So I was admitted there and it was horrific. I'm like frantically Googling as much as I can. They took away my cell phone. I remember for the first couple of days, I remember being humiliated, having to strip all of my clothing, with someone in the restroom with me and having like to squat and cough as if I'm like trying to confiscate illegal drugs. And I understand why they're doing that, but I'm being treated like any other person in the facility with an addiction. And first of all, people with addictions should not be treated in this horrific way at these facilities, but unfortunately that's what happens. So I find myself at this place, and they are basically cutting my dose like in half every single day because there's a lack of education. So they're treating me as if I have an addiction to some other illicit substance like heroin, cocaine, or even legal stuff, like alcohol. Just a very fast, quick process where they provide these, I forgot the term they used. What's the term for medications to basically help ease the discomfort? And so they were offering me, I remember clonidine was one of them to help the anxiety, and a muscle relaxer as well, and trazodone to help me sleep, because at that point I was getting maybe a couple of hours of sleep a night. And so I was very hesitant, and I kept insisting that I take very minimal doses of these things because they were pulling me, or what happened, because I had been cold, I'm trying to remember the details, I had been cold turkeyed from the retired specialist. Oh, but then, that's right, before he left being my doctor, he had told me get back on the Ativan and then go to a hospital. So he was the first to recommend that I do that. So maybe I had I went from like 1.5 to taking like 1 milligram, something, a lot lower of the Ativan. And so at this detox center, I was given very minimal doses of Ativan, and I think eventually switched over to Valium because it lasts longer. But that should have been also like a multi-week transition process from one class of benzodiazepines to another. Which, if you're in a detox center, you're typically not going to be there long term, which again is why it's so important for this process to be patient-led, alongside with a prescriber who is informed and aware of how to safely come off the benzodiazepines. So anyway, so I'm learning, I'm talking to people, I think I'm still I have discovered like Benzo coaches at this time. I've discovered the Facebook groups of people who are injured in the same way, who we collectively share anecdotal data from our own personal experiences to not only help keep each other safe, but also to validate one another. Because throughout this process, when you go to these physicians and to the emergency rooms, and when you seek help from your loved ones, your family, you're constantly minimized, misdiagnosed, gaslit, dismissed. It's an incredibly isolating experience. And then that in turn will often, or at least and I've talked to other people too, it makes you question your own self. And so you start feeling really crazy. And this is at the height of physical suffering that you never knew could exist. So it's just such an awful process. So, so I'm politely refusing all this medications that's being thrown at me. And I'm trying to present basically one of the only legitimate documents around safely coming off of benzodiazepines that was around at the time, which is sad because it was established in, I think, the 70s. Anyway, it's called the Ashton Manual. And this was a physician with a lot of training around benzodiazepines. And so she would help her patients at the time slowly come off of them in a very slow, hyperbolic way. And so So I'm trying to present to the clinical director and these nurses at this detox center, the Ashton Manual, a very credible source of this is how to safely come off of benzodiazepines. And they're just, again, gaslighting me. They're assuming that I just want more benzodiazepines, which is crazy because here I am telling them over and over, I want to be off of this stuff because I'm viewing it as poison. So I want to get off of it as fast as possible. And yet I'm presented with this information to go very slowly. So anyway, so I was there for a couple of weeks in total. It was horrific. I remember, I'm feeling a little bit just like dizzy and lightheaded talking about this stuff. But yeah, I remember being there and they would have us all gather in this like cafeteria space for, I want to say like breakfast and dinner every day. And I just remember like being so panicked, and it was beyond panic isn't even a word to describe it. I mean, every night that I was there, taking this trazodone would allow me to fall asleep, but then I would wake up in the middle of the night with these night terrors where I would just be screaming, not knowing where I am at, and crying, and it was awful every single night. And my pupils were severely dilated. I felt so just on edge, which I now know it almost felt like this like extreme surge of electricity where I couldn't sit still and I had to keep walking. I now know that it's called akathisia, which is it's such a horrid, one of the worst side effects of benzodiazepine withdrawal. And so I couldn't even interact. I could barely interact with my peers at this place. And so obviously people would ask, like, what are you here for? And I would be honest about my story. And they would just be looking at the way that I'm presenting and not believe me. Like, there's no way. Like, okay, sure, yeah, you took minimal prescribed benzodiazepines for 4 weeks. Sure, yeah, and you look like this, just very gaunt, right? Dilated pupils, barely able to formulate sentences, can barely maintain eye contact, extreme panic. So I wasn't even believed by these other people who were also being minimized and ostracized within society and judged and overly medicated. So it's just, the whole thing was just horrific. I had even at the time too reached out to a previous professor of mine who had extensive training within working with people with substance use and addiction, which again, I know that it wasn't appropriate for me to lump myself in with with other people with addictions. However, that's where, in doing all of my research, this benzodiazepines had been lumped in with all these other substances. So I figured maybe she knew more than what I was getting from online Ashton Manual, Facebook groups and whatnot. And she was so sweet. She took my call that night that I reached out. And by the way, she has a PhD, like very, very highly trained. And even she seemed a little baffled at my circumstance, and sent me what she could, sent me resources to try to help calm my nervous system. But yeah, it just seemed like no matter who I reached out to, I was given all these different answers, and I was further harmed in such horrific ways by medical doctors that I didn't know who I could trust. So when I leave this center, I go home, and let me just find where I'm at in my notes because I've kind of went all over the place here. Ashton Manual, polydrugged is the term when these detox centers will put you on a whole bunch of other medications, and then you're supposed to slowly taper off of those medications, and they can also cause more side effects and harm. So that's another reason why a lot of people who have gone through this experience will never say to go to a detox center to come off of a benzodiazepine. Um, yeah, so I talked about the autonomic nervous system dysfunction, which is all these things that are supposed to be autonomic functions of the body, like heart rate, heart beating, our breathing, pupil dilation, blood pressure, all that's supposed to be just things that just happen without us thinking, has been blown to smithereens. So mine's all over the place. So I go home, I still can barely sleep, and this is wild. So I've always been wildly independent, like freakishly so. I can be by myself for long periods of time and not feel lonely. I don't know what that says about my traumatic past, but it is how I operate as an adult. Very comfortable being alone. But I keep saying panic, but that's not the word. This kind of suffering, there's really no words in any human language that can fully describe what happens. But one of the words that we talk about is monophobia, so the intense fear of being alone. I couldn't even sleep by myself. So I had my mom sleep in the same bed at me at, how old was I at the time? 35, I think? No, 37, 38, I don't know. Kind of everything blurs, but someone in their mid to late 30s sleeping with their mom every single night because I was so terrified that I would die in my sleep. You're just terrified of everything. I remember, I think I spoke about this in my last video, I couldn't watch even remotely scary things on TV. Like my mom and I have always enjoyed watching those investigation discovery docuseries, and I couldn't watch that. I couldn't watch even drama movies or definitely not horror movies. So there's this, the amygdala or other fear centers within the brain that are extremely just dysregulated and heightened in this experience. So I talked about the night terrors, couldn't sleep alone. I remember consistently asking for my mom or just anybody. I would post on these Facebook groups for reassurance. Am I going to be okay? Is this permanent? Over and over. Like, you don't trust what they're saying to you. I mean, you do, especially once I discovered that there were coaches who had been through this experience, who were who had master's or doctorate level education in counseling, who would tell me, like, you're going to be okay. There are several people who have gone through this before you, including myself, who have healed over the years or who continue to heal and get better. And so you will be okay. Oftentimes, because our fear is so heightened and because our symptoms are so extreme and new and consistent, I mean, this happens day after day, which turns into weeks, which turns into months, and at this point, years. I'm 2.5 years out and still dealing with symptoms. What was I saying about the fear? Constant, just seeking reassurance. I understand now why I did it and why people do it, is because the reassurance doesn't last. And so you have to constantly, every single day, ask, am I going to be okay? Am I going to be okay? Because that's what keeps you alive through this process, is hope. Hope that one day you're going to get better. Just to touch on some other symptoms, there were so many symptoms. It was insane. I know that at one point, because I kept a daily diary of everything that was happening to me, easily over 50 plus symptoms altogether. But the ones that stood out for me is I had symptoms of jaundice. My whole body went yellow, so my liver was struggling to get through this. I could barely shower or walk. I was having gastroparesis, so my digestive system wasn't working properly. It felt like it was paralyzed. I had really, really bad abdominal pain as well. And then extreme blood pressure fluctuations. So I could go from laying to sitting and have like my heart rate go 30 beats per minute more. And then from sitting to standing would be like another 30 plus beats per minute, which is just, it was so wild and scary. I would constantly be checking my pulse. I was eventually, by the way, and I think I mentioned this in the previous video, I was diagnosed with POTS, which I still have to this day, even though it's gotten a lot better. I had DPDR, trying to remember, depersonalization and derealization is what it stands for. So, for instance, when I would go outside, all of the light and sounds and wind and every environmental element felt so overstimulating because my nervous system is so raw at this point. And especially going into like a grocery store where there's lots of moving pieces, lots of people, very harsh overhead fluorescent lighting was just, or even driving a car was just so difficult and so extreme. So I had agoraphobia, which I had never experienced anything like this in my life. Over the course of the first, I would say 3 to 5 months, I went to the emergency room probably like 6 to 8 times, which isn't uncommon. A lot of people do this because we constantly feel like our heart or we're just going to die. And when you pair that with extreme lack of sleep and barely eating and all the other symptoms that are happening, and feeling extremely isolated and depressed through it all, you go to these places where it's like a last-ditch effort to be saved. And then, like I mentioned before, you are further labeled as the anxiety patient. You are dismissed. If you are given tests and your heart checks out as far as you're not having a heart attack, you're basically discharged. You're not paid attention to. No one talks about this being a nervous system injury or an assault on your nervous system from benzodiazepines or other pharmaceuticals. There's no talk of that. It's just dismissal, gaslighting, and minimization. Oh my gosh, this has been 42 minutes. I'm going to try to go faster than I have been. So I meet a primary physician at a very prominent university who also is just very confused with what's going on, prescribes me mirtazapine and suggests that I try ashwagandha. Both of these things make my symptoms a lot worse, and I stop. And so, she's frustrated working with me as well because I'm not listening to her advice, but unfortunately, she just wasn't given the proper education when it comes to benzodiazepine and nervous system injury, at least in the way that I have been injured. And I don't want to discredit her education or even her intention. I'm sure she means well or meant well. And I'm sure that a lot of doctors or other people in the health industry that I had encountered, whether they harmed me further or not, I think a lot of them didn't have malintentions at all. There's just a lack of education, and there's this preservation of ego that took a front seat instead of the patient's health, unfortunately. So yes. Yes, I'm on the Facebook groups. And I was reading lots of horror stories which scare you because you read about people not, being injured for years. And at that time, you can't even imagine going through that kind of suffering. It's extreme physical and psychological terror. And you're alone, you're isolated and not believed and mislabeled and misdiagnosed and It's horrific. I would not wish this on my worst enemy. I feel extremely, extremely sad for what I had to go through and for what other people have to endure. It's just horrific. And so so in this Facebook groups, you feel an immense amount of support. You feel seen because other people have gone through this or are going through this. So you feel validated, but you're also terrified. And then I keep bringing up all these things that I'm reading about and feeling validated by to my family. And they're like, stop reading this, because they think, again, in their mind, it's just, they reduce it to something that's understandable for them because they don't understand what's going on. So they keep saying, stay away from these things that are giving you more anxiety or panic, that are making you worse. And so I would try to explain, well, no, they're actually validating me, making me feel better, and also making me scared, even more scared than I was. So it was a double-edged sword. But again, I just want to emphasize that they are a big part. I would say that, coupled with the Benzo coaches, are a huge part for why I'm still here today. And I'm so, so grateful. Eventually, I find a doctor who is educated in safely tapering people off of benzodiazepines. So he suggests that I go back up to 1.5 milligrams of Ativan, so the highest dose that I had taken, even though I only took 1.5 probably for like a few days out of that 4 to 5 week period. But he said the best thing for me, because I had been so injured from the cold turkey experience, was to get up to that same dose and stabilize for a certain amount of time, and then very slowly taper over months. He said it could take 6 months, and I think that he was being conservative. It probably would have taken longer, but he knew that my frame of mind is, get this poison out of my body. I can't trust doctors. I just need to get better as fast as possible. I didn't know, I wasn't fully on board with the idea of, I need to stabilize this extremely sensitized nervous system and then gradually help it to achieve homeostasis to where it can learn to function on its own again by slowly and hyperbolically tapering off of the Ativan. So I fought him a lot on that, and we kind of met in the middle, where I learned through one of the Facebook groups how to do a liquid, like micro taper. And so I tried doing that. I mean, it was such a mess, but, I was reading stories about other people basically taking their pills and crushing them up and putting them in water, using these like tiny syringes to every single day, just reduce the dose minimally, gradually every single day. So I think I did that for maybe like a month, and thinking in my head, oh yeah, I'm slowly tapering, and so I should be fine. I should be better within a month. So I basically cold turkeyed myself again. And so I underwent 2 cold turkey experiences in this time span of like a couple months. So anyway, incredibly thankful for meeting him. And he really was helpful, even though I didn't follow his guidance to a T. Yes, so all of this, while I'm going through this, I'm obviously I moved back home, and I had just bought a house in a new state. I just graduated grad school. I was in the process of starting my own private practice to start working as a unlicensed mental health practitioner in order to acquire hours under someone who's licensed to get my license. So all of that came to a hard stop. I mean, I could barely function day to day. And so over these past couple of years, now I'm seeing my grad school colleagues get their independent licensure over this last year. And it's been while I'm so excited for them, genuinely very happy and excited for them, and know that they're going to continue to do incredible work. And I'm just so proud of what we all went through together in grad school. I'm disheartened that I was set back in this horrific way, and that my journey to becoming a therapist has been put on pause. I want to believe, and a part of me truly does, that things happen for a reason, and I'm going to be able to help people in a much more significant way, having gone through this experience. And so I'm trying to be positive about it, but yeah, there's a lot of grief within that experience as well that a lot of people don't realize. And it's not just me. I mean, anybody who goes through this, most people cannot work, can barely take care of their families. I mean, I can only imagine, like, had I had children to take care of, what that would have been like. So anyway, so I do eventually find a coach who I worked with for quite a while, Dr. Jennifer Swankowski. I believe she goes by Dr. Jennifer Swan. She has a YouTube video, and I highly suggest you check out her videos. But she had encouraged me to get back in touch with my creative side in order to facilitate my healing process. So I took her up on that. I mean, I could only believe what these that's how I held on to hope, was believing these people, these coaches who had been through this or are currently going through this, but are ahead of me in my journey. That's how I had hope. I had to hold on to them telling me, you will get better. It might take a while. It's not going to be linear. You're going to have setbacks, but you will get better. You will heal. So I trusted her, and I took a leap, and I got back in touch with my creative side as an actor, and I moved to Atlanta. And so that's what I've been doing for the past about year and a half at this point. And I have had my challenges for sure. It has not been easy auditioning, and then I booked a project, a feature film this year, which was really exciting. And so I was able to go on set and have that experience and show myself that even having all these symptoms, I was able to still endure the process of working as an actor for many hours under an immense amount of pressure, and do it quite successfully. So that was proof that I am healing, I am getting better, and I'm still able to engage in these things that I love, even though they can be hard. So I'm very, very, very grateful to Jen. And I feel like she was truly a guardian angel for me in this process. Along with I worked with other coaches as well. And I would be remiss not to mention them. So Angie Peacock, who also makes lots of YouTube videos. Dr. David Powers also makes a lot of YouTube videos that you can watch. Dr. Jennifer Lee also makes a lot of YouTube videos. And they were all very helpful in this process in different ways. So I definitely want to give them credit. Baylissa, I don't want to forget Baylissa. She's been doing this for so long. Was actually friends or knew Heather Ashton, who created the Ashton Manual. And she has a lot of online resources as well. But yeah, so where are we today? Yes, I still have POTS. I still have issues with my blood pressure and my autonomic nervous system not functioning in a normal way. But light years better than I was in the first 6 months after the dental procedure and the benzodiazepine injury. I still have sleep issues. I rarely can sleep throughout a full night. I'll wake up throughout the night, but I can typically fall right back asleep, which I'm so grateful for. It's way better than just getting 2 hours, 3 hours of sleep, which happened for weeks at a time. I didn't even know that the body could withstand that and that someone could survive that, but many of us do. It's It's wild. It's crazy. So yeah, sleep issues. I still have digestive issues. Not the gastroparesis. So things are like moving along a lot better, but still just not back to my normal baseline. I have skin issues, so a lot of just skin dryness. I don't know if you could see it on camera, but I have these like red bumps that developed on my temples. And that happened while I was in that detox center, actually. So I've had that ever since. And then my forehead will get especially dry and flaky, like my skin just flakes off all the time. And I'm very, very sensitive to supplements. I've experimented taking, like fish oils or phosphatidylcholine or things that are just like normally seen as like not risky or harmful in any way. However, when you're dealing with an extremely sensitized nervous system, what I've learned is it's so easy to have reactions to these otherwise innocuous things. So my most recent trial thing that I tried was creatine to help build, because one of my symptoms was I had a lot of muscle wasting when I lost like 20 pounds in those first 6 months. And so now that I'm trying to regain muscle, in my research, I've seen that creatine, I've taken it in the past too and been totally fine, but oftentimes people will mix some creatine with their like protein powders. So I tried just a minimal amount of creatine one day, and it set me back for like a week, where I had numbness in my face come back, the redness got worse, my heart was beating a lot faster, my sleep was worse, but I knew how to deal with that at this point because I had been through so much, and I know that this process is nonlinear, that I knew not to lead with fear. Like I knew I'm going to get better, I just have to ride this wave. So it was uncomfortable for about a week or two, but I knew that I would eventually feel better, and I do. So please keep that in mind, that when you have these setbacks, or you feel really great for a month, and then the next month you feel like you're reverting back to feeling injured, or like you're not going to heal ever, just know that that's part of the healing process, and that you will continue to heal. What else? So yeah, very sensitive to supplements. At this point, I'm staying away from everything. And then if I'm deficient in any sort of vitamins or whatnot, I try to, and I've been doing this whole time, actually, this past couple of years, is trying to get my deficiencies through natural food sources. I've not had a sip of caffeine or alcohol since I've been injured, and I don't plan to anytime soon. I don't want to introduce anything to my body that could potentially compromise my system and my healing journey. And I've noticed that my hand will turn purple when I'm in the shower, which is wild. My feet also get purple, so I know that with POTS, a lot of the times the blood will pool because it's just the blood pressure, the heart isn't beating efficiently to where it's regulating the blood flow throughout the body in a normal fashion. When I go out for a walk, I try to walk about an hour and a half a day or 2 hours when I can. And my hands will get swollen when I'm doing that. My feet are numb, which that's been a symptom throughout this thing, is numbness and tingling in my feet, especially when I'm sleeping, like if I wake up in the middle of the night. So that will still happen when I wake up in the middle of the night. I still have memory issues. As you can tell, my speech is a little funky. I kind of trip over my words, but eventually get there. I have more frequent headaches since before the injury, but not as much as like that first year. Like it's getting better. I have occasional chest pain. I have visual issues where I'll see like black squiggly lines just kind of appear in the periphery of my vision every now and then. And then for me, a big symptom that I've had is just a persistent hard heartbeat. Like the electrical conductivity is just still out of whack. And I'm sure that that's directly correlated with my sensitized nervous system and dysfunctional autonomic nervous system. So, and that will get worse if I work out, like if I do some cardio exercise on a bike or if I run, I'll know that my heartbeat's going to beat harder and faster for probably a couple days. So I just know that, and I don't get scared of it. I just know it's part of the process. Yeah, just all this to say, overall, I'm doing much better, much better than I was. Even like that first year, it was really scary. It was pretty bad. And like I said, I still have these symptoms, but nothing will compare to that acute injury where living day to day is an accomplishment. Staying alive moment to moment is an accomplishment. I'm so lucky for the support that I had through these coaches, through the Facebook groups, through my own research, for fighting for myself, advocating for myself through this process. I'm so lucky to be here today. And I'm going to continue to make videos and continue to advocate for myself and for others who are harmed and to prevent further harm from happening. Eventually, Big Pharma is going to have to answer for all of the harm they have caused and will continue to cause. Prescribers, like I said in my previous video, need more education around this. They also need to provide informed consent to their patients. And yeah, I'm excited to continue to see how this healing progresses and how this advocacy work pans out. I do want to let you know that I'm open to any questions you may have. My goal here is to just tell my story as authentically as possible and to help others who are going through something similar, help them survive and navigate this process, and also prevent others from being injured in a similar way. So thank you for listening. It's only been an hour. Until next time.